Assalamu alaikum friends, welcome to my channel MBBS and BDS lectures. Today our topic is related to general medicine Sideroblast Anemia. Before going to topic outline, if you want to watch the same topic, same lecture in Urdu Hindi, I already upload the same lecture in Urdu Hindi on my YouTube channel. Go and watch that video. But if you want to watch in English language, then this video is for you. Now, in last two videos before this video, in one video I explained the definition, causes, clinical feature and classification of anemia. In classification, we classify anemia on the basis of RBC size into three main group. Number one is microcytic anemia, number two is macrocytic, and number three is normocytic. Now in microcytic, we put three types of anemia. Remember by mnemonic, sit down, SIT. S mean Sideroblast anemia, I mean iron deficiency anemia, and T mean thalassemia. Now in last one video, before this video, we study iron deficiency anemia in detail, which is type of microcytic anemia. But now today we study next type of microcytic anemia, which is Sideroblast anemia. Now come to the topic outline. Today we study the definition, causes, pathophysiology, clinical feature, investigations, complication, and management of Sideroblast anemia. First, we start from definition. Basically, Sideroblast anemia is a microcytic hypochromic anemia in which there is an abnormal accumulation of iron in RBC. Mean in RBC, there will be abnormal accumulation of iron, and it is a microcytic and hypochromic anemia. This is simple definition. Sideroblast anemia is a microcytic hypochromic anemia in which there is a abnormal accumulation of iron in RBC. This is definition of Sideroblast anemia. Now come to the causes. There are two main causes of Sideroblast anemia. Number one is hereditary, number two is acquired causes. Now, hereditary causes we divide into two. Number one is ALA deficiency. ALA deficiency means amino leucinic acid synthase deficiency. If there is ALA deficiency, in the result there will be Sideroblast anemia. Number two, in hereditary, number two cause is X-linked disease. Because Sideroblast anemia is also a X-linked disease, means X-linked trait which transfer from parents to offspring. These are the two causes which come in hereditary. Now come to the second, acquired causes. Again, we divide the acquired causes into two. Number one is primary, number two is secondary. Now in primary, the type is idiopathic, because the cause of primary is unknown. Idiopathic means unknown. Now second is secondary. In secondary, two causes are come. Number one is toxin, number two is drugs. In toxin, there is a zinc and lead poisoning, and number two, in drugs, there is isoniazid and chloramphenicol. These are the two causes which come in secondary. Now, the cause of Sideroblast anemia is complete. Now come to the pathophysiology. In pathophysiology, normally it is erythroblast, which later become erythrocyte. This is the nucleus of erythroblast. This is the mitochondria of erythroblast. Now in sideroblastic sideroblast anemia, there is a abnormal accumulation of iron in mitochondria in the form of ring. The accumulated iron, which I show by black, they form a ring. Now this erythroblast will be called a ring erythroblast, and also sideroblast mean also ring. Therefore, due to ring erythroblast, this anemia is called sideroblast anemia. Basically in pathophysiology, there will be iron accumulation in mitochondria in the form of ring, and the erythroblast called ring erythroblast. This is the pathophysiology of sideroblast anemia. Now come to the clinical feature. There are 8 clinical features of sideroblast anemia. Number 1 is pallor. Number 2, dizziness. Number 3, fatigue. Number 4, liver disease. Number 5, hepatomegaly. Number 6, splenomegaly. And number 7, cardiac arrhythmia. And number 8 is renal failure. Its clinical feature is simple like other type of anemia. Now come to the investigation. We do basically 3 main investigation for sideroblast anemia. Number 1 is CBC, number 2 is blood film, and number 3 is bone marrow aspiration. CBC show microcytic hypochromic anemia, like we already studied in definition microcytic hypochromic. Now CBC show complete blood count show microcytic hypochromic anemia, small cell mean corpuscular volume less than 83 micron, and hypochromic mean pale color cell have less hemoglobin. Number 2 is blood film. Blood film also show microcytic hypochromic anemia. Number 3, the third is bone marrow aspiration. The bone marrow aspiration show ring erythroblast. Ring erythroblast. These are the 3 investigation of sideroblast anemia. Now come to the complication. There are 2 main complications of sideroblast anemia. Number 1 is heart failure. Number 2 is pericarditis. Why? Due to cardiac arrhythmia. Now last is management. In management, if the cause is hereditary, we give pyridoxine to patient. Pyridoxine means vitamin B6. And if the cause is acquired, then we remove the cause like drugs toxin. Like drug toxin. If cause is acquired, we remove the cause like drugs, isoniazid, chloramphenicol, and toxin like zinc and lead poisoning. Now today our topic is complete. We studied definition of sideroblast anemia, causes, pathophysiology, clinical feature, investigation, complication, and management. Now if you like my videos, press the like button, and if you new to my channel, subscribe my channel and press the bell icon to open the all notification in order to you receive my all new video notification. For watching my videos, I am very thankful to you. Thank you very much.